Welcome to The Doctor Will Hear You Now, a podcast featuring our physicians and other healthcare providers telling their stories, sharing glimpses into their daily work and mission, and showing what it means to practice medicine just a little bit differently. Healing you means hearing you. Let's talk. I'm Lexi.
And I'm Ben. And today we're joined by St. Francis Health nurse practitioner, Mary Kathryn Edwards, to talk about building relationships with patients through listening. Mary Kathryn sees patients in Northeast Louisiana at St. Francis Primary Care Clinic in Monroe, and she sees patients virtually across the state via video visits. So, Mary Kathryn, welcome.
Thank you.
So can you start by telling us a little about yourself and your work for St. Francis Health?
I earned my Master's of Science in Nursing from Franciscan Missionaries of Our Lady University, it was now Friend U in Baton Rouge. I am a board certified family nurse practitioner and a member of the American Association of Nurse Practitioners and Louisiana Association of Nurse Practitioners. I'm currently employed with the St. Francis Medical Group. I'm a nurse practitioner at St. Francis Primary Care Clinic with Dr. Greg Green. I can see all ages, but typically see age 13 and up. But I work with an incredible staff, and I mean, it truly is an honor, and I love coming to work every day.
Wonderful to hear that you stayed in the family after getting your degree at Brand New, so we're so glad.
Yes, actually, I got my nursing degree when it was Our Lady of the Lake, so then transitioned on to Franciscan University. So yes, it was a great experience.
Oh, that's awesome. I'm so glad to hear that. I'd love to hear a little bit more about just primary care and the work that you do as a primary care provider. Can you give us an overview of primary care, what it is, and why it's so important that people have a relationship with a primary care provider?
Primary care providers they're also known as PCPs, and they're knowledgeable in diagnosing and managing patients with both acute and chronic conditions. PCPs provide individualized care, helping each patient achieve their best overall health and well-being. And this is typically achieved through preventative care, early detection of illnesses and conditions such as cancers, treating common everyday illnesses like your common cold. We see flu, COVID. We also manage chronic conditions such as diabetes, hypertension, COPD. We also do referrals to medical specialists. So we use this proactive approach to help our patients stay healthier and live longer lives.
You mentioned chronic illness a lot, and even someone who doesn't have a chronic illness, would it still be good for them to connect with someone like a primary care provider or you?
Absolutely. Yes, we see acute conditions every day.
A lot of the focus of our conversation today, I think, is going to be around listening and listening to your patient. And so obviously we know that healthcare can be somewhat hard to navigate sometimes for patients. And our health system has tried to make this promise that we're here to listen. We're here to sit beside our patients. We're here to understand their stories, be full partners in their health. And so from your perspective as a primary care provider, what role does that active listening play in your work? And how does listening sort of build and strengthen that patient relationship for you?
Well, it forms a bond of trust, over time between the patient and the provider. When I know my patient, it provides added insight, which allows me to deliver a more personal care approach. And this is why I truly enjoy belonging to a profession that allows me to develop these personal, long-lasting relationships with each of my patients. It's been my experience that patients who are more compliant with their plan of care when they feel engaged in managing their health. These relationships, they start with an open and honest relationship between the patient and their provider.
Let's dive into that patient-provider relationship a little more and kind of take it back to the beginning. What advice do you have for patients to prepare for appointments, especially new patients who maybe you haven't seen before, they want to establish that relationship? Is there something that can make listening easier for them and you? Any questions you wish they would ask or open up about?
I always recommend just bringing a list. Make a list of any, questions, concerns, symptoms that you have. That way we kind of stay on task. They're able to stay focused on what we're talking about in the moment, and we can address each one individually during that visit. Most of the time, the first visit with the provider is to establish care. And at that visit, it's important for the provider to offer a relaxed atmosphere so that the patient feels comfortable sharing their information. This is a time for the patient to be able to focus on providing information that will give their provider a better understanding of who they are, their medical history, and their health needs and concerns. During this visit, we also look at the patient's medical records, their medications are reviewed, as well as discuss any personal and family members' health history. A general exam is typically performed during this visit as well. And then follow up visits will focus on individual healthcare goals and strategic planning to help improve and manage their specific conditions.
In addition to bringing a list of questions, do you have any sort of advice about maybe bringing a significant other with you to sort of be your companion in that process?
Absolutely. It never hurts to have another set of ears that can listen to exactly any plans that you may develop, because a lot of times they hear one thing and then they get home and all of a sudden either they can't remember, or, what they were focused on was something different than what their significant other, picked up on. So it helps to have another set of ears. And then it helps me as well, because a lot of times too, they can say, "Oh, remember you were complaining about this," or this was going on. And then something that the patient completely forgot about. So, absolutely, having someone else in the room with the visit, very important.
Once we're in the room or you're in the room with the patient, as that provider, are there different ways that you use your body language to show that you're listening? Like, how does that good, open body language help promote better discussions with your patients?
I'm somebody that's always been an anxious person. So, especially then going to the doctor, I always first say, "Hey, I've got white coat syndrome." Like I feel like it's very, very important for them to feel relaxed, and you provide a relaxing atmosphere for the patient first and
Hmm.
foremost. I feel like that quickly eases any anxieties that they may feel, and they're more in tune to open up and communicate any concerns that they may have. I typically try to make brief notes when I'm jotting down any important information so that I don't lose too much eye contact during our communication. But I also, I feel that there's so many nonverbal ways to communicate as well. Body language can provide important clues to a patient's feelings and emotions. The provider must also pay close attention to their eye contact, their facial expressions, their posture, their head movements, the position of their head and arms, leg placement, because these are all nonverbal clues that are very important part of communicating through using body language, and to convey to the patient whether or not you're actively listening to what they are telling you. Even moving closer to the patient or physical contact, placing your hand on their arm, or other important nonverbal ways of conveying empathy as well.
I think that's so important. And just as a provider who is seeing someone and maybe you pick up on the patient being anxious, are there what I guess is your best advice on the provider side is if you notice that maybe the patient isn't feeling listened to, or even you feel that the patient isn't listening to you as the care that you're giving, are there things that you do to better connect with them or to make them feel more comfortable in that moment?
Sometimes I just let them know a little bit about myself too, even things where I feel I fall short, or things that I'm anxious about. Not to make it about me, but just to let them know that there's no judgment. It's an open, honest relationship. And I feel that's very, very important, because the patient needs to know about their provider as well.
Definitely. I think that's always helps to establish some common ground
Right.
and make it feel not so like you're just talking to a stranger. You're talking to someone you can trust and have a relationship with. So that's really great to hear.
Absolutely.
What are things that you like to hear from your patients? Are there things that are maybe non-medical that you like to hear about from them that you either can help you better care for them or get to know them better, just more about their life story?
I'd love for them just to tell me a little bit about themselves, what their interests are, hobbies, occupation, so that I can get to know them better. I find it humbling though when patients do feel comfortable opening up and disclosing information with me and sharing any concerns or struggles that they may be dealing with. And getting to know each patient on a deeper level not only establishes great rapport, but it also guides me in developing an appropriate individualized plan for each patient.
That's great. So now, what message, I guess, would you give to a patient, or what would you tell someone who might have had a bad listening experience with a provider in the past, and you're trying to help them overcome those fears or hesitations with seeking care?
I would just remind them that while the overall goal of patient care should all be the same, sometimes the approach to managing patients' healthcare needs and concerns can be different. It's important for patients to find a provider that makes them feel comfortable and confident in the care that they're receiving.
Are there any stories that from your work that illustrate good listening or that you've seen really where listening has made all the difference in a patient experience or a patient encounter and how that really helped care for them better?
I have. I had one patient come in. He was an older man. He was a smoker, but he was telling me about this trip that he had been on. The thing he didn't like about it was all the traveling, and being in the car, the sitting. And he came in for something completely different. And then I noticed kind of as he was leaving, he kind of was walking a little bit with a limp, like his leg was bothering him. And asked him what was going on, and he said, "Well, I've just my legs just kind of it's a little swollen and been bothering me." Well, it ended up he had a blood clot. So it was just came in for something totally different. Had I not known that he had been traveling and putting in that history, then that kind of connected all the clues together. So,
Yeah, that's great. And also, I like how he didn't necessarily tell you that his leg was sore, but you kind of noticed in his
right.
movements. And so I think even the act of noticing is a great form of listening and caring for people as well.
Absolutely. Absolutely. You definitely have to look at the whole picture.
Yes.
And I guess a lot of times they wouldn't even think to ask you about that. They would just
Right.
let it bother them until it
Exactly.
it's too bad.
And then that happens too. Yes.
I was curious if there was anything else that we didn't touch on that you might want to share or anything you wanted to make sure that our listeners were aware of. And when it comes to listening and working with their primary care provider.
I'm really inspired every day by the relationships between me and my patients, our staff. I mentioned earlier that anxiety is something that I've always struggled with. And so I really kind of thought all my life it was more of a curse. But now I do realize that the Lord graciously has called me into healthcare so that I can help others that are battling with anxiety because there's so many out there that deal with anxiety, depression. Through active listening, I feel it's crucial to adequately manage mental health as well. I feel mental health is just as important as physical health because there's very few diagnostic cues with mental health. It's not like you can come in and we can just test you for strep throat or flu, COVID. Vital for the provider to listen to what their patients are saying and to adequately treat them. And then I use my own struggles with anxiety to empathize and to care for my patients. And additionally, it has become therapeutic for me in overcoming my own anxiety.
I'm sure it also helps you recognize cues in other patients because you know what triggers it for you. And so you're able to kind of recognize that and care for the patients.
Absolutely. Yes.
I'm curious though, like what are some of those ways that you recognize that in your patients or can sort of spot the anxiety and sort of calm their fears?
They're usually tense. They don't want to show emotion. A lot of times we'll kind of hold back. I don't really know other than that. I guess sometimes I can just feel it. I can just kind of feel that they're anxious. I can look at their blood pressure. Now there are times you can look at their vitals and that'll tell you, too. And then we'll recheck them before they leave and their blood pressure's back to normal. Grip in their hands, they may be shaking their leg, different types of body language that'll be clues to that they're anxious. Or they'll come in and just say, "I'm short of breath, but I don't really understand. I feel like I can't get a deep enough breath." But and after we've ruled out everything that's physiologically wrong, a lot of times looking at just some of the everyday little symptoms that they have, will put it together as well.
It's interesting as you're saying that combining the hard medical data that you gather with just that human to human connection.
Right, right. And sometimes you have to throw textbook out the window. Not every person is textbook. So you just have to rely on your instinct as well. And that's when communication and building a relationship is so important. And after you've built that, you can kind of know when you're patient, when something's off. So it helps you to establish a better plan of care. I think it kind of goes back to just the write down the questions, making sure that you come with a list of your concerns and to try to get those answers. If you're not able to feel that there's a connection between you and your provider, then at that time it may be a good idea to find somebody that you connect with. It doesn't mean that that provider is not a great provider, but you may just not connect with them in a way that provides you with that peace. And every provider has their own way of their approach, too. I think it's just important, yeah, to just to know that you have confidence in the care that they're giving you.
What would you say to the anxious person who maybe is so anxious that they're scared to even make an appointment to come to see a doctor or a provider? What would you tell them to help them build the courage to take that step?
So many people, it's about like cancer, they're just the fear. And there's now so many screenings that we can do for early detection, for prevention. I always, colon cancer is one that you'd be surprised. A lot of people it's really hard to get them to screen with the colonoscopy. They now have the Cologuard different ways. And so I always try to say, teach them that early prevention is life saving. I mean, and so even though it's scary, we don't want to come in but when you come in and we can find things early, your prognosis is much better.
Would you say it's always better to, if you have any fear or any slight pain and you're just like, I don't know if that's bad, or maybe I just ate something funky, or would you rather them always come to see you over just waiting it out?
Absolutely. I mean, I always tell patients too that, hey, we're erring on the side of caution. We would before we just blow this off as something, let's make sure it's not something more serious. And then once that's ruled out, we can kind of look at different ways, whether it's indigestion or different things to kind of lifestyle modifications to make.
So, what inspires you to keep going in this as a nurse practitioner?
I love to make a difference in each patient's life. And again, it goes back to I have white coat syndrome myself. So like I know what it's like to have that fear to walk into a doctor's office. And I just want to always make that something that is not a negative experience. It inspires me every day to create a positive environment for each one of my patients, and then to see their health and well-being, and to know that every day, we are saving lives.
Thank you for joining us, Mary Kathryn. It was so great to get to know you and learn more just about what you do and how you listen and care for patients in our health system.
Well, thank you for having me. I enjoyed it.
Great. We're so glad that you could be with us. And for our listeners, thank you for tuning in. We'll have everything that Mary Kathryn mentioned and other helpful resources linked in the show notes. We'll be back soon with more episodes of The Doctor Will Hear You Now, a podcast from Franciscan Missionaries of Our Lady Health System.
And if you have ideas for topics you'd like to hear on the show, please email us at podcast@fmolhs.org. Thanks for listening.